Good morning, everyone. We're going to go ahead and get started. There's a couple more people that will be filtering in. Thank you so much for joining us for our next breakout session. This is our Congestion Mitigation Program breakout. This will be given to you by Thomas K. Edinger from the Delaware Valley Regional Planning Commission. Tom is Manager of Regional Congestion Management. Tom has 25 years of combined experience in transportation planning at the Delaware Valley Regional Planning Commission in Philadelphia, at the Tri-County Regional Planning Commission in Harrisburg, and the Lehigh Valley Planning Commission in Allentown. Tom obtained a master's degree in city and regional planning from The Ohio State University and currently holds an American Institute of Certified Planner certification. He has worked for about 7 years at the DVRPC, and his main focus is on the Congestion Mitigation, Congestion Management Process, or CMT program, including working with Transportation Improvement Program, the TIP, the Long-Range Plan, and other sections to identify and prioritize congested locations and identify multimodal strategies to reduce these congestions. We welcome Thomas Edinger. Thank you.
Thanks, Tracy, for that welcome. Everybody can hear me okay? I'm not quite sure. My name's Tom Edinger, Manager of the Regional Congestion Management Process Program at DVRPC. Tracy mentioned there, I've been there about 7 years. And what I'm going to talk a little bit about today is not just about strategies, which I'm going to get into, but also basically how we identify particular congestion issues in the area, how do we prioritize those, and how do we use the data and other information to help develop strategies for managing congestion. It varies by certainly arterial roadways versus limited access roadways, etc. And then to kind of look at the causes of congestion, what's behind it? Why is it happening? Right? Sometimes it's very simple. Sometimes it's more complex. And then certainly developing strategies. And then one of the most important things that we're trying to do more and more of, which is required part of the CMP, is to evaluate the effectiveness, evaluate performance. Is it getting better? Is it worse? Is that strategy actually working out there as part of what we're working on? So I guess the opening slide is, what is traffic congestion? I think we all know that, right? Basically, too much demand out there for the supply. And so one of the things we always refer to congestion is recurring and non-recurring congestion. It's recurring, it's happening all the time at a given location, right? A lot of times that we attribute that to lane drops versus non-recurring congestion, be a crash, potentially disabled vehicle on fire, anything that we don't plan for, right? Which is always the issue. So how do we manage both of those kind of types of congestion? So for the congestion management process, the CMP, what we do is we basically take a lot of data, and whether it be travel time data, which is a big data set could be from TomTom here, INRIX is what we use, look at travel time data or travel volume data from PennDOT, travel demand model data from our organization, DVRPC, and we kind of identify and then help prioritize locations, given that information and other information, and develop the multimodal strategy. That's a key part of the CMP. So basically, how do we use public transit, walking, biking, TSMO strategies to manage congestion rather than driving alone? And then certainly evaluate the effectiveness of these improvements. Is it getting better? Is it getting worse? One of the big parts of the CMP really, it's a required program, part of federal legislation, but it really, all the work that goes into that is input into the long-range plan, which is headed up by some other staff in our organization. So it's a 4-year effort. Basically try to end the update of the CMP so that where the long-range plan will start. It takes all this information and helps identify and prioritize projects in the long-range plan, and then sometimes as well on the TIP as well as part of that. Like I said, it's a required process. So really part of the regulations, looking to manage strategies that they're not single occupant vehicle, right? Everything but driving alone. How can we do that better? And so the CMP kind of leans toward that. It's really overarching goal, and then kind of informs the process of the long-range plan. And it's all kind of governed a little bit by the CMP Advisory Committee, which is made up of DVRPC member governments the counties, transit authorities, TMAs, DCTMA, Federal Highway Administration members, and then basically other members as well. So it's an advisory group that helps guide, how we are, what's the process, are we doing the best process? All CMPs aren't equal across the U.S. Most MPOs have to do them as long as you're a non-attainment and over 250,000 or whatever the number is. I lost track of that, but all the big MPOs have to do them. So the idea is how can we, but they all can do it a little differently. And so we've taken a different approach than maybe Pittsburgh or Tri-County or Lehigh Valley as far as how we manage it. One of the big differences these days is that we have access to this travel time data from, for vehicle probe, archive probe data, GPS data. And so we can have a great opportunity to understand what's going on out there and then kind of evaluate performance. Versus before, 10, 15, 20 years ago, it was all about doing traffic counts or getting somebody else to do counts and look at that, or using our travel demand model, trying to understand where trips are going to and kind of do, build, no build scenarios. So how does it help the DVRPC region? Basically kind of two levels, on a planning level and on a kind of a project tip level. On the planning level, kind of like I alluded to before, we are trying to identify particular locations where we think there's potential issue areas or evaluating projects that come to us from the municipalities, the counties, and are they the most important? Are they actually congested? And how do they fall into the regional program of what can be kind of managed first for managing congestion? So it essentially helps programs get developed and programmed on a long-range plan. On the other hand, it also works at kind of the project level with the tip. So what we call projects that have major SOV capacity adding or close to it, we will work with the DOTs, the consultants, any other partners, kind of like PennDOT Connects. A lot of you maybe are involved in that, but to a certain degree where we're looking to develop other supplemental strategies as well as capacity adding as part of that project. That's kind of required for the CMP. And there's always been that kind of what is major capacity adding, but the other term we use where it basically has a major impact on travel movements. What is that, right? So we don't necessarily put like an exact what is capacity adding, but certainly if you're going to put a new interchange in, a new movement in an interchange, lane widening 2 to 3 miles, that's kind of major. So we kind of couch that a little bit. But the idea is we want to make sure we're getting the best investment out of those kind of projects. And frankly, we want to use the CMP to help the municipalities, the counties, our other planning partners. So when you're developing a project, when you're working through comp plans, your transportation plans, look at the CMP and see what strategies that we've identified for certain areas. Those will be looked favorably if you're implementing some of those strategies as part of your projects when they get updated on the long-range plan and the tip. And we do that a couple ways, which I'll kind of allude to here. We got some time, so I'm going to go through this a little bit slowly. So one of the things we have in the CMP is we call them objective measures. So one of the key objective measures is improving mobility and reliability. That's kind of the mission of the CMP, and that's the core of it. But we also realize that we want to do it in appropriate places, not just everywhere. And that goes with a lot of the guidance we get from federal highways and some of the goals and objectives of our long-range plan. So, for example, integrate modes and provide better accessibility. So where can we provide improved mobility and reliability near transit stations as well as bus stop locations? Modernize the existing transportation network. So we look at roadways like on the national highway system or a major freight network. We look on those where we have congestion on those areas favorably to managing congestion. Achieve Vision Zero, right? Like the county has a Vision Zero plan, the city does. We're working on one as well at DVRPC. Where do we have incidents of high crash rates or severity? We want to manage that where we also have a lot of congestion. So how do we manage that, right? That's always that balance, mobility and reliability versus safety. I wish I could provide you like the solution today for that. Yeah, but I'll try to get to there a little bit. Provide goods movement, right? That's one of our other things. The last mile deliveries. How do we manage congestion in the urban areas like the city of Philadelphia or some of the areas like in media? How do we provide better mobility reliability there so we can but also provide good goods movement. Maintain and enhance transportation security, that gets at really where we have high population employment densities. And how do we manage congestion in those locations if there's an issue, or heavily used transit stations. And then supporting our long-range plans, goals, objectives. Invest in urban centers, prioritizing less environmental sensitive areas, and invest in EJ communities, looking at equity in EJ as part of that. So basically, roadways that meet more of those CMP objectives than others are looked on more favorably. So we do that as part of the CMP, as well as just looking at mobility and reliability. And then, as you can see here to the right, are some of the mobility or reliability measures. And some of those are basically based upon both the travel time data, like I mentioned earlier with NREX, and traffic volume data we get from the DOTs. So travel time index, has anybody worked with the travel time data at all, the vehicle probe data? So you might know it a little bit, but like a travel time index, right? So the idea, the greater the index, the more of an issue, right? So you take the observed travel time divided by the free flow travel time, the posted speed limit, right? On the average, what is that? So the higher the value, the worse. Planning time index is very similar, except it looks at the 95th percentile travel time. So you kind of stack those travel times from most to least, and whatever that 95th percentile is, right? So that gets at that reliability factor as far as travel times. So, plan for that. And then vehicle delay is something similar to TTI, except it's just taking the difference between the observed travel time and the free flow travel time for essentially one vehicle. And then volume delay is just multiplying that times the ADT factor. So you basically, where you have a lot of delay per vehicle and where you have a lot of ADT, like, 80,000, right? That's a lot of people are affected by that. So we want to look at that as well. So we both look at both types of delay, and then ridership delay is for the routes, the SEPTA routes, for example, where we conflate the routes to this travel time data and look at which areas are congested using a PTI measure, as well as looking at ridership. So areas where you have high ridership and high unreliability, that's an issue. Can we manage that better? So that's part of what the CMP is. So I just gave you one kind of screenshot here of looking at this travel time index from NREX. This happens to be the year we did the last update of the CMP. We just finished it. It's a 2023 update. And what you're seeing here is basically this NREX travel time data with the higher the value, basically the darker the color, the browns, the lower the congestion would be kind of in the yellows or grays. And so it kind of points out here during the peak period 4 to 5, where potentially the congestion locations are. A lot of this isn't surprising to you. I'm sure you look at these areas and say, yeah, I know it's congestion there. But that's a way of us to kind of calibrate the data, measure the data, and kind of see what it's telling us. And this slide here shows the CMP objective measures I talked about. So we're basically looking at roadways that meet those C objective measures. More of those objective measures are met, basically the higher the score it gets. So we just classified it into these classes here, basically greater than 9, 6 to 9, 3 to 1. So the idea is you can kind of see a correlation, but not always, between areas in brown here and areas kind of in the browns or reds. So for example, I just noticed here for example, US 1, locate some areas there, Springfield Road, right, which I passed up this morning. It was backed up northbound going to US 1, right? Baltimore Avenue. So these probably aren't too surprising to you, but this is another way of kind of measuring the data by segment as far as what's going on out there. Oh yeah, this just shows that basically that area was clipped out of kind of the regional map. Again, roadways that meet more CMP objective measures than others are scored higher. So at the CMP, we basically have a number of levels of analysis. So I kind of just showed you the segment level, but we basically look at a regional or county analysis to understand what the trends are, and how is, for example, Delaware County perform relative to other counties. Then we drill it down to what we call focus roadway corridor facilities, right? Not just a segment, but a corridor, like along Blue Route or along 291. Or along PA3, right? So we look at a corridor, and then focus intersection bottlenecks, basically intersections. So obviously a corridor could be maybe performing bad, but there's one intersection causing that, right? The rest of the corridor is pretty good. And so we want to understand where along that corridor is the issue area. And then we also look at limited access bottlenecks. That's something we added in the latest CMP. Obviously, where we have ramps, backups, maybe short ramps, for example, or lane drops, 3 to 2 lanes, 2 to 1 lane along those roadways. And then also bus transit facilities. So again, we take some of the routes and conflate it to the travel time data to understand which routes are more unreliable. And then we also use what we call these congestion corridor subcorridor areas. I was just talking to somebody before. We have this big binder in our office developed back in the 1970s. That when we did analysis of congestion, we broke the area into areas. So we still keep those today. The idea is that we really can't plan or have strategies for all facilities in the region. So we developed these areas, or these blobs, some people call them. And so we actually help use that as a way of trying to measure performance in the region as well, but more importantly, to develop strategies from that. But one of the problems is there's multiple facilities sometimes in those areas, so it's difficult to know what strategy belongs to what facility. But here are some particular trends here, looking at the travel time index by county. I wanted to show this, looking over the last 5 years. It's just the average travel time index. And you can see here, actually, Delaware County is tops for congestion, given the data. Even over Philadelphia, 2020 was about tied. But so certainly, given the area, there's some congestion. Chester County is the lowest on that. You can see the big drop from 2019 to 2020. Not surprising. And then really all the counties going up from 2022 to 2023. If you look at like Bucks and Chester, they're actually close to pre-COVID levels, but not yet. The other ones aren't as close. That's kind of a general kind of trend there. That's looking at the highest peak hour between those 4 different peak hour time periods as part of that. We also wanted to break it out and look at just Delaware County and show by hour of the day, 6 a.m. here to 8 p.m., what is the travel time index and how is that changing? So interestingly enough, right, pre-COVID, 2019 is where you have the highest peaks, right, during the AM and the PM. In 2023 and 2022, in the red and the blue, you can see they're not quite as peaked, right? It's kind of more spread out. So I think that's interesting. You hear that anecdotally and probably when you drive around, right? That's the idea that traffic is being spread out more, especially here during the PM peak. So that's one to think about, whether you're a DOT or municipality or county. What are we planning for in the future? Are we going to plan for that peak, or are we planning for maybe less than that moving forward because of COVID, people maybe getting more flexible hours now, working at home? How is that changing? So we're certainly going to keep on monitoring this and see how that plays out moving forward. Look at the vehicle miles traveled, how much travel is going on out there. So here we looked at all the PA counties in the region, plus just the DVRPC region. So you can see here that Delaware County, actually you can see kind of from 2000 to 2007, right, there was a lot of increase in VMT. Then with the Great Recession and gas prices, VMT went down, travel went down. And then from approximately 2011 to 19, there was kind of a gradual increase. But if you look at Delaware County, it kind of remained kind of stacked. There wasn't that big increase like some of the rural suburban counties, right? So that points to like a lot of people are using other potential means, not necessarily buses and public transit potentially. And you can see, so that's kind of the trend here. You can see the big down in 2020 and then 2021. Really none of the counties have reached pre-COVID levels there, but getting close according to the data. Just want to look at SEPTA ridership. Probably you sat in on this morning with the presentation from SEPTA, so I don't want to go over this too much, but certainly even before pre-COVID, right, there was this kind of downturn in taking transit in general for all the different modes, buses to regional rail. And of course, it bottomed out in 2020, 2021 due to COVID. This is basically the fiscal year, 2016 to 23. And you can see it's on the rise again, but it's really not quite close to pre-COVID levels. I take SEPTA every day when I go to work. And so I notice that it's always packed, right? Tuesday, Wednesday, Thursday, but Mondays and Fridays not as much. So that's kind of the trend I see but even that's changing a little bit. So I see questions, how far does that come back, right? That should inform us a little bit on our strategies. Put more emphasis on encouraging more riders back to transit. We also kind of look regionally at non-SOV travel. This happens, you're looking at the one-year ACS by county in the region, so not surprisingly, Philadelphia has the highest, about 50% of non-SOV travel. The travel is non-SOV travel. And then basically Delaware County is second, right, with approximately 26% on average from 2006 to 2019. And of course, it went way up in the last year, 21, and I've seen the same data in 2022. I think that's out, kind of showing that a lot of that's due to working at home, right? That's part of non-SOV travel. So how do we deal with that when we're talking about developing strategies for managing congestion? Certainly, if you're home, that's going to put less congestion out there, as we've seen, right? So that's a good thing. That's what we've been doing with TMA. That's one of our kind of big strategies, right? Alternative work hours, working at home. But there'd be more of a conversation on how hopeful it is to actually potentially getting certain types of work done. Not everybody can do that. And then finally, I think the last trend slide here, but this is non-SOV travel for Delaware County, right? Showing basically from 2010, 5-year ACS in this case, not the 1 year, going all the way to 2021. The last 2 years, 2020, 2021, obviously went up a lot in working from home, from 4.9 in 2019 to 10.9, right? It's a big jump. At the same time, you see kind of a decrease, right, in public transit, given the not from 9 to 8%. So, that kind of, you think about how we manage congestion. We want to see what's going on out there. So, to sum it up, more work from home, still not at pre-COVID conditions for VMT, and less taking public transit. And then the crystal ball is where's it going to go from here? Okay, so kind of got to drill down a little bit, look at focus roadway corridor facilities. So these are basically facilities, about 202 in the Pennsylvania portion of the region. Some are long corridors, some are short. The idea is we want to measure performance on these locations and understand which areas are performing better than others. So the idea is to trend this. Here we're looking at volume delay, which is essentially the vehicle delay as a function of ADT. And you can see areas like, right, the blue route, PA3, a number of areas are popping up in Delaware County, 95. Again, this is volume delay, so you're going to see it's a little biased to areas where you have a higher volume. So then we develop these lists and say, okay, which are the most congested, which are the least congested? And this is basically highlighting Delaware County. So there's approximately, I think, 25 facilities that we've analyzed in the county area. And kind of, you can see here, I basically you can see them up pretty good from here actually, but the bubbles are basically showing there's a roadway name, the from and to limit, the miles, limited access or not, the county it's in. And then there's some rankings here, like the vehicle delay, how that's ranked. So these areas here are actually supposed to be dark brown, so they show up. They're the lowest numbers, meaning they're the highest ranked, the most congestion. And then the yellow areas are the least, right? And then we have volume delay over to the right. See, sort of pointer on here, is there?
Top right one.
Top right? I got it. Oh, there you go. Thank you. This is volume delay right here, and this is how that ranks, okay? And then there's that CMP objective score I was talking about earlier, so each one of these facilities is ranked as well. So I just kind of highlighted the top ones for vehicle delay and volume delay. So you can look at number 1 here, number 16, okay, right here. So that's Baltimore Avenue, showing up for the highest vehicle delay from US 13 to Bishop Avenue. And then for volume delay, not surprising, like area on 95 from I-476 to US 322. So that's kind of how we look at this. We're trying to identify which areas are performing the worst. And then we look at where are the most congested locations out of that list. And we do it by county. Each county identify the top 2 congested locations for vehicle delay, volume delay, using a couple different travel time and planning times. And so we came up with this list of 6 of them. And so we want to drill down further with those and say what strategies are best for those locations, which I'll get to in a minute here. We also looked at intersection bottlenecks, okay, a whole nother analysis, but again, mostly using travel time, data, and volumes, looking at all the delay going into an intersection and which ones are worse than others. Again, develop lists, as you can see here, again, with the intersection name, municipality, the county, et cetera. And then, again, looking at the most congested for vehicle delay and volume delay for an intersection, okay? And sure enough, you got 2 locations here. Number 1, which is the number 1 at the last CMP update, was on 322, Cherry Tree Road, Bethel Avenue, and 322. No surprise there, right? And there's a project going on right now, TIP, to help improve that. The second one on there is US 1 State Road and Springfield Road. That seemed to indicate high vehicle and volume delay as well out of those. And there's a couple that are pretty close. Here's the third one here. So I think what we did is we took the top two for vehicle and volume delay and then added the Springfield Bishop Avenue on there as well. So that just helps us kind of focus on potentially where we want to, but it's not just limited to the most, right? We're looking at all of these as well, but just kind of looking at these ones pop up given the analysis. We also wanted to look at the focus limited access bottlenecks. Again, basically the ones that show up are on the blue route, 995, which areas are showing up there that are not performing well at all, and not surprising. For example, on 476 southbound ramp where PA3, right? So basically there, you get that lane drop starting from 3 to 2 lanes right on the blue, and there's a TIP project right to handle that. So there's a number of different strategies we're trying to do with that already. Flex lanes, variable speed limits, dynamic lane assignment. I'm probably stealing some of the thunder from a couple other slides here. But that's kind of one of these TISMO ITS strategies. And then I'm not going to go into the bus routes, but that's important too. So we analyze which are the most delayed, given some of the information I talked about earlier. That's kind of how they mapped out. Of all things to do this analysis with bus revolution, right? So things were changing. We weren't sure if they were going to have the new routes and get rid of the other ones. So we ended up with a kind of a hybrid of some of the routes were planned for and some of them that we thought were going to stay the same. So, but we did that analysis as well. By the way, I will mention that the CMP report, it's just going through some final editing, but that'll be made available on our website. So right now we have web mapping that's new and updated for this update of the CMP that we just did, but we don't have the report quite yet on there. And finally, we look at these big blob areas, we call them congestion corridor and subcorridor areas, and we want to kind of prioritize which of those areas are most important for managing congestion. Realize you can't manage it equally everywhere, so we look at the CMP Objective Measures, input from our CMP Advisory Committee, as well as our other studies out there. So we identify these priority congestion corridor areas, and then areas where we think capacity adding is most appropriate. Again, the CMP looks at not capacity adding as the first alternative. How can we manage congestion by using all these other modes? But from that, we develop these areas and identify those, and if projects are in those particular areas, they look favorably on the TIP or the long-range plan. So they're using this criteria that we've developed at DVRPC. This is just a kind of a screenshot showing the corridor areas. There's like 68 sub-corridor areas in PA. There's 20 corridors in all, and then each corridor is broken out into like sub-corridors, like the blue route's broken out into different sections. For example, 95 is broken out into different sections. But that kind of helps us identify strategies, right? There's some areas that are rural, some are urban, some are more limited access, some are more urban arterial. So strategies vary, some are more based upon that. Populations are different. This is a slide showing the priority subcorridor areas, okay? Given our analysis and meetings with our advisory committee, and these are the ones we have as, quote, major capacity adding. Now, just because if there's a capacity adding project that's happening on an area that isn't highlighted in this magenta color, doesn't mean that it's not going to be considered. The idea is you go through the CMP process of trying to get a project on a list of potential capacity adding and try to do studies, like do it before, after studies. Can you actually manage that facility by not adding capacity to it through improving bus transit, biking, walking, right? TISMO strategies. What can we do to get the most out of what we have? And if we have to, then we have to add capacity. But that's kind of the process. And I have a slide on some other considerations as part of that. So, all right, so we've kind of identified areas, we kept prioritize them. Now let's look at essentially what's causing these issue areas. What potentially might that be? And that's always a challenge, right? And then also using our CMP Objective Measures, our data, and trying to understand what's that telling us about what the right strategy might be. Try to develop a data-driven process, and we're still doing that. And look at all the corridor studies that have been done out there, or county planning studies, municipal level, county level, consultants, others that have basically developed a number of recommendations for certain locations. That goes in the calculus too for the appropriate strategies. And obviously input from our advisory committee, who know these areas better than potentially we do, except where we live in our county. Right, so This is a slide showing causes of congestion based upon the RITIS website, which is basically a University of Maryland Cat Lab, houses a lot of travel time data. So as part of that, they have a contract with the DOTs, PennDOT is one of them, where they obtain all the traffic event data that's captured through the CCTV cameras, as well as Waze data that they use, and basically populate a database of that. And then it's basically time-stamped on, when the event happened, when did it start, when did it end, so you get that duration factor too, which is important, not just how many events, but how long that event took place. And then what type of event was it? Was it a crash? Was it a disabled vehicle? Was it short-term construction, long-term construction, different types? So what I've shown here is I wanted to look at all the different counties in the DVRPC region, all 5 of them. And if you look at, for example, traffic incidents, Delaware County is actually tops in that. So that would basically mean some kind of disabled vehicle, again, crash, and it has to be responded to as part of the freeway service patrol. So that's 10%, again, higher than all the other counties. The other thing I wanted to look at was how to basically look at, again, recurrent, non-recurrent congestion. And essentially, if you add up the recurrent, which is part of their database, as well as considering work zone, which would be long-term work zone, and signals, that adds up to 58% due to different types of recurrent congestion. If you add up for each one of the counties, actually Delaware County has the highest recurrent congestion. So, that could help a little bit. Areas that are need updated to current design standards because of a lot of the, roadways that were built in the 50s, right, just haven't been updated yet, right? So I'm here shaking your head, yes. For example, we worked with PennDOT and others on trying to understand better the project on PA 352 and US 1, right? That interchange there, those ramps are probably the oldest in the state, right? So the idea is that they're very short, right? The site distances are bad, and so that project is an example of needs to be brought up to current design standards, and so that's that's congestion mitigation as part of that. You wouldn't call that capacity adding as much as just widening a roadway. So anyway, this provides a source of information, but you want to drill down a little bit further if you can. So you can take the same data and basically aggregate the point data by a facility. So for example, we use the CMP focused roadway for corridor facilities. And then try to understand for traffic incidents, just looked at incident. We could have looked at construction or weather, different types. Which ones have not just the most incidents, but which ones have the longest duration, right? There's an issue with a crash and like a fatality, right, can take many hours for the police to investigate that, right? So that duration's a long time versus ones that where somebody's pulled over, it's not just, maybe the car still has to be towed, but it's not ultimately serious. That could be a lot shorter duration. So try to understand that a little bit. So for example, traffic incident management, right? Should we provide more hours of service on that area of 95, for example? That goes into some of the analysis. And then we want to try to use our CMP Objective Measures, the data we analyze. So, crash information, and our mobility reliability data, travel demand model data, actually, where's forecasted congestion be? We took some of those links and updated them to the INRICS as well. And so we want to try to make sense, where's transit, right? So a couple of ideas here. Where you have high congestion, it could be, or high unreliability. Where do we have bus stops or transit facilities? So we want to basically, for buses, improve maybe transit signal priority, bus rapid transit, right? These are kind of a little bit general, or just provide more frequent service, whether it be a bus or a train, right? To provide that, to improve, to make improvements there. That's important areas for managing congestion. Areas where we have high congestion on limited access roadways, right? We're doing a lot of that with ITS, ramp metering, certainly on the Blue Route, we're using that pretty effectively, I think. Not everywhere we use that, but it seems to be effective on the Blue Route. Traffic message signs, where if there's a particular incident on the main line, don't get on, basically take another route. There's awareness where there's issues. Incident management, talked about that earlier. Integrated corridor and active traffic management, or ICM, which is integrated corridor management, right? How do we make these parallel roadways work better when there's an issue on the main line? So we're doing that a number of different locations. I know right now there's a lot of effort in the county neighbor of Philadelphia on I-76 when that's bottled up, provide parallel roadways that put TISMO strategies on there to make more effective to move traffic. Same kind of things we're looking at on 476. Let's see what else here. Yeah, incident management. Active traffic management, where we're using the flex lanes, variable speed limits. These are proposed on 476, the blue route. Dynamic lane assignment. So those would be strategies where we have that. High transit score, that basically means areas where we have high population employment and zero vehicle households. And where that's near passenger rail, bus transit, better walking and bicycling improvements would be more important in those areas. So instead of people making a short drive, right, they get out of their car and walk to those locations. How to make that better. Modify existing transit routes and services. Again, make it more enticing to take transit. And then outreach and marketing. That's the TMA. How do we get more people to use a bus or basically not driving alone to get to their destination? And then we have high, low income, racial minority, using information, socioeconomic data, Latinx, LEP. Make sure for those project areas we're reaching out to develop the most appropriate solution for those areas, right? That's also part of the CMP as well, and that's the goals of the long-range plan. And again, where we have high crash rates and severity, making sure that some of the improvements in there, it's congested, but making sure we're doing substantive safety improvements, right? You've heard that term lately. And I'm probably preaching to the choir on a lot of these things. Substantive, what are we doing a little bit extra besides just doing the systematic approach to safety? Other things that basically make safety better than it ever could be as part of those particular areas. Okay, so we've basically used some information to help us develop strategies. Let's talk about some of the strategies and then kind of dive into a couple areas. So in the latest CMP, we have about 125 recommended strategies. Too many to list here. You can get on when the report comes out, you can see them on there. Basically, kind of divvy them up between these 5 different buckets. And for example, we added some, for example, curbside management for goods movement. How do we manage the deliveries along the roadways, which adds to congestion? How do we manage that better? And so kind of in that order too, so road improvements through roads is kind of the last option as part of that scenario. Actually, I have a little bit more here. Maintain, so this gets into how do we apply those strategies. Maintain and modernize the existing transportation network by bringing roads, bridges, transit facilities up to current design standards, just like we talked about at 352 and US 1, right? And provide easier transfer between modes. Kind of then, it's kind of the second list is provide TISMO improvements, optimize the efficiency of the roadways, right? Try to manage transportation demand, TMA work, alternative work hours, foster efficient land use patterns. This is what gets to the municipal level, right? How can we develop our land use regulations, our zoning codes, land development ordinances to improve it such that we can walk to places or bike to places, right, better than driving, right? That all these little things I think can add up. How do we develop more connections to the circuit trail, right? Those are other strategies we have. So each one of these, that's why at the regional level, sometimes it's kind of difficult. You need to really, as you know, drill down to particular areas and find out what is the best strategy. But the idea here is that we add road capacity is kind of the last kind of order of strategies. And then we develop these strategies at both the facility level, which would be the intersection or corridor facility, as well as these areas. So let's take a quick look at some of the corridor facilities. So we developed these like profile sheets in the CMP report. And essentially the yellow area is like a corridor. The one we're studying here is the US 202, 322 from PA3 to US 1, right? That's one of the most congested corridor facilities. We kind of list the bottlenecks that are on that particular corridor given our analysis here, all right? US 1. Basically what the travel time index is, and if there's bus transit, it's kind of in a light blue. You're not be able to see it too good here. The focus roadway facilities, other facilities that are along there, SEPTA rail, if it's available, and then the ADT we provide here as well. And there's just information generally among particular area, a kind of a summary, some tip projects that are going on. For example, there's a tip project here on US 1 and 202 to help manage congestion there. So, we're trying to tackle some of these locations. And then we have these very appropriate strategies. So I basically just kind of copied up to here. Some of these are coming from the area itself. If there are some in here that we need to be replaced or add or take one out, move one in, by all means, let me know. So we tried to do this by working with our advisory committee and our county governments. So basically, ones that have already been done or in the process of being done are signal improvements and ITS. These are other appropriate strategies. Some of these are ongoing, like incident management. Some of this applies to Chester County, obviously. This is one of the corridors that goes, right, this portion includes Delaware County here. And then we have these secondary strategies, which are really coming from our subcorridor areas, okay? And so there's a whole laundry list of them, but the idea is they were developed based upon our CMP Objective Measures, kind of more data-driven and input from the advisory committee as well. But certainly these are some other options for that particular area. The next one here is Baltimore Avenue from US 13 to Bishop Avenue, right? More of an urban corridor, walking and bicycling improvements, signal improvements. We've identified it has been done in the past. Things that, right, transit infrastructure improvements, improved circulation, access management, right? That's kind of what that means. How can we provide better management of the road systems there to TOD, transit-oriented development, and modification of existing transit routes or services. Okay. Baltimore Pike, a little bit farther west, right, between Bishop Avenue and 476. Some of the same type of appropriate strategies, signal improvements, placemaking for non-motorized transportation. How can we just make it a better place to walk and bike, maybe to get to your destination rather than taking a short trip in a bus or a car. Expanding park and ride for existing transit. I think this is important. So the idea here is that instead of actually taking Baltimore Pike at all, is there another way that you can get to public transit where you can easily park and then take that in rather than driving in through Baltimore Pike. So make it easier to park remotely somewhere else and take public transit. Park and ride lots kind of goes along with that. Okay, getting her up on my time. Another corridor, yeah, I-95, right? So that's a whole different animal, right? So that's certainly limited access roadway. These are more TISMO, ITS type strategies, incident management. Not too surprising there on some of those. As far as projects go, there's travel demand, I-476 travel management tip project, trying to improve. That's actually just right, whoops, oh my. I knew I'd have a problem with that. Right, so they're, as part of that I-476 traffic management, where they're doing variable speed limits and dynamic lane assignment, you can just kind of pop it in there. Part of that's going on to I-95 as well, right? So it's not just 476 or the Blue Route, it's part of I-95. Oh, thank you. Okay, and then also kind of the same strategies for this I-95 from 322 to the state line. Okay, and then Lansdowne Avenue, right? So that's much a lot different, right? Really an urban corridor there. Signal improvements, transit infrastructure improvements, improved circulation. There's actually a tip project here, right? Lansdowne Avenue corridor safety improvements, really going more towards safety. But I guess one of the questions there, that's kind of one of these dynamics is, how do we improve safety along that corridor as well as provide mobility and reliability, right? And so I think we can certainly talk about that, and so I think the way I look at it is it's more of like you got to find alternative modes if you're going to travel on that corridor, like bus routes or to get from one location to another. And then we have the bottlenecks. Okay, there's just 3 of these here. Springfield, Bishop Avenue, right? This isn't too far from us. State Road, Bishop Avenue. Okay, showed high up on the list. Right, so right in here is the particular issue area. And right, this one here, again, this is TIP project as well going on, TIP project going on there. Make improvements, right? Section 103, I think it is. Strategy by subcorridor area. Break it up to these very appropriate secondary strategies. We have strategy notes. What's going on for that particular project. If there's major minor SOV capacity projects going on in that corridor area, any long-range plan projects, adopted corridor study. So the idea is if you get on this website, you can see at the bottom left, basically you see all the subcorridor areas there for US 1. So that's the US 1 corridor broken up into a number of different subcorridor areas. You click on a particular subcorridor area, you go to this website, so it lists the very appropriate secondary strategies, okay? And again, if you're developing a project in this particular area and you want to look at these lists if you can to help see if and develop a strategy that's based on some of these, that would help look favorably for the project and on the long-range plan or TIP. We look at what these strategies are appropriate everywhere. A lot of these are TDM strategies, all of the work hours, carpool, for example, context-sensitive design rate. These are things you pretty much do everywhere. Some strategy notes. So this talks about the US 1 352 project, meeting with the county and PennDOT, or with PennDOT on this to understand what was going on. If we can provide any help on that. Major minor SOV capacity projects that are going on in that corridor. And then finally, long-range plan projects, and then adopt the corridor study. So literally go in there and click on these and actually go right to the corridor study. So just trying to put all this information in one right place. Finally, the last thing I'll talk about is that the CMP also want to evaluate performance. So we use these project assessment reports, work with the CAT lab, which is this RITIS tool, and we want to understand the before and after. Is it getting better? Is it getting worse? So we use these three tools, reports the most. So this is kind of like a PowerPoint presentation slide. It shows US 202 from the state line up to US 1. We're looking actually here between 2018 and 2023. And so the actual improvement, TISMO improvement, was done in that time frame. And we looked at the PM peak, 4 to 6 p.m. We actually have another sheet for the AM. And so we looked at these different metrics. Looked at basically, I go from the bottom up, PTI, travel time, speeds, and then delay cost. So basically red means it got worse, whether the speeds went down, the plane time index went up, and the green means it's good. In other words, mobility, reliability improved. So you can see southbound, it actually got, according to the data we analyzed, the performance didn't get better, right? It got worse, it worsened southbound on 202 after this improvement was done. And then we drill down into a couple charts. So we look at this performance charting, and we essentially look at the 2 years modeled, which is 18 and 2023, right? So the idea is you would want 2023, the green, to be lower, have a lower PTI than 2018. So if you look at A here, performance improved, okay? So basically 2018 was a lot of congestion, it was high, and 2023 was lower, so that's good during the AM. During the PM, performance declined. The green was higher than orange, right? So this is for that whole corridor, just for that particular hour. So you know what's going on in between certain intersections isn't necessarily help. I won't go through all this, but that's one way to look at this information. The other is use this congestion scan. So this is basically looking at the same data. The idea is we're looking at, I have a tough time getting that location here. We want to just look at between 6 a.m. and 9 p.m. so we can change the sliding scale where we want. We look at the 18, 2023 for southbound, and then 2018, 23 for northbound, right? And then we look at the PTI. So basically what we usually say is between 2 to 3 is moderate unreliability, and anything in the red or the magenta is like high unreliability, right? And so we can just point out some areas where there's, in 2023, there's more unreliability. From the advantage of this congestion scan, it actually looks at intersection to intersection. So it's kind of more helpful than just looking at the product corridor, right? So that's one helpful thing about that. So from US 1 down to just past Smith Bridge Road, that's an issue during the PM peak, for example. And then finally, the last one here is this user delay cost one. Now, there's too much data here to read, but the idea is this is kind of neat because it looks at all hours of the day and then for every day of the year. So the idea is, you know, it could be maybe there's just a lot of construction going on for a couple of weeks, and for that whole year, right, it kind of inflates the PTI and the TTI. So you can literally like, see where the red areas are, is where you have like high travel times, higher volumes, and then it tries to assign a cost to it based upon vehicle costs. But the idea is there is, yeah, you can kind of understand maybe, is it always happening during the peak periods or just during certain times of the year? All right, and then just some next steps. What we want to do is kind of refine these strategies for certain areas, work with our partners to be better at employing these strategies, which hopefully when the projects get on the plan or the tip, that they could be look favorably, probably do a better job of performance evaluation, and then kind of the next step with our CMP to kind of move forward and do better. So I guess with that, I'll open up the questions. We've got a little time here.
How do you track real-time data? Do you use like cell phones or daily?
It's
track it daily.
It's daily. It's literally every minute it's captured, and then you can aggregate it to different levels, like 15 minutes, an hour, which is what we're showing. But it's basically vehicle probe data. It's been around for a while now. There's different vendors. There's TomTom, there's here, and there's Inrix. Inrix is the one that DOT's bought into, PennDOT. So they bought into it, make it available to the county planning partners. So the consultants that work with PennDOT get it, you can use it too. And I think they are using it. And it's getting better all the time. The idea is it's not really using phones as much as the GPS is built into the vehicles. Right? But all the new vehicles coming out pretty much have that.
What rate do you use for delay time? When you put a dollar value?
Like, well, yeah, that's a question. Like, what's the criteria threshold for delay?
So I know in the field of public health, there are criteria for how much money it's worth to like reduce fatalities. And so how do you balance that with delay? Like how much is an hour worth?
Were you talking to David Cantor, the city yesterday? Because he asked me kind of, which again is the same question. They're trying to do a cost benefit study. So for example, if you reduce crashes so much, then how much effect does that reduce delay? That was kind of one of the things he was doing. And I didn't have an answer. But it's still undeniable that if you mitigate crashes on the roadway, congestion's going to get better. But how much does it get better? For example, if you want to add more freeway service control out there, how much incremental value do you get by getting cars off the road and reliability? I think my question was, my answer to that was probably just need to do some research. Maybe look at the Transportation Research Board or TRB, see some studies out there that try to quantify what the cost benefits are of some of these strategies to do a little bit better. And that's kind of where I think we need to go with the CMP. It's my second update. I'm kind of a little tired actually doing all the data part. Like we know where the congestion locations are. And so that was a challenge. And then we do want to know how that's, what's causing that. That would help us inform some of our strategies. So that's kind of where we are now. But then the next part is how do we know what strategies can give us the most benefit? And that's kind of where we are now. Have you been working with safety data, like safety countermeasures? That provides like a kind of some information. If you basically do an improvement in a particular location, like that's going to improve crash rates, reduce crash rates, and improve severity right to a certain, based upon the project of all areas of the country. I think that's changed that.
I have a question. The work zone data that you use, is that work zone, is that everything that they're doing, including like infrastructure, and it's not just PennDOT road work? It would be like Pico stuff and Aqua stuff. Is that everything included in that?
Yeah, that's a good question. So like if they're doing tree trimming along the roadway?
Yeah, like that kind of stuff.
And we would consider that short term, like
Okay.
so that's like one of those other kind of the non-recurrent.
Okay.
Versus the long term that's publicized, like work they're doing on 95.
Correct.
But that's more we call that. I would say it's more recurring as long term because everybody knows about it.
Okay.
And you're just going to get stuck.
Okay. Yeah. Yeah. Yeah.
But yeah, the database kind of does indicate what type of construction is going on, or work zone is going on.
Okay, so it would be notated if it was, let's say, a 6-month project to replace water pipes. It would be notated somewhere.
Yeah, they're trying to do a pretty good job at it, yeah. So that's something we can pull out to a certain degree.
Okay.
So if that's something you're interested in, we can try to do something. Just something to think about.
Interesting, yeah, okay.
We'll just give you the,
Yeah.
but usually it's spreadsheet. But it does have a lot of model associated with it, so you can map it pretty easily.
Well, we would be more interested in looking at, like, I guess the provider or the originator of the work. Like, is it a PennDOT work or is it an infrastructure work? And then kind of breaking that down, is it electric or water or people? You know what I mean, that kind of stuff.
So you could basically kind of inform the public on exactly what's going
Exactly.
on.
Well, so in Delaware County, because our footprint is so much smaller and one small closure makes that much more of an impact, we're trying to kind of manage the communication a little bit better. And PennDOT is great. Like, PennDOT will give us everything that PennDOT's doing. It's the infrastructure that we're having problems getting that information from.
Yeah, so the data comes from the DOT through the cameras, that's one way, and through Waze data.
Oh, okay.
So, you know, the thing is with Waze, it does cover the roads that aren't covered by cameras, but is it like authoritative data? At least that's one of the things you always think about with Waze.
Piggybacking off of that, does the,
So Josh?
yes,
Yeah, I remember you.
yes, I'm interested. Does the data or strategies take into consideration like coordinating with all of the utilities? Because I know something that we've struggled with is PennDOT will go through and tear up the road, and then Aqua will come in next summer and tear up the road, and then Pico will come in and tear up the road, and there's, you know, a lack of coordination between the three, and that could, you know, turn short term into long term.
Yeah, I mean, I know, for example, there's like in the city for Philly, they've had these asset management systems where they basically update all those jobs in there so they know if there's like an overlap between one and another, they can coordinate. I think the question is there some kind of way that this data can be integrated? And that might be, I'm not sure if this DOT database I'm getting at gets that specific, on being able to integrate the data like I wanted to ask, but that's certainly maybe a start on what could be done with capturing some of that data. Yeah. So I think the event database is in there. Any other questions? I appreciate you sitting there.
Thank you very much.